Hello everyone, this is Dr. Sangeeta Chaudhary once again. I welcome everybody to my channel. In my today's class, I am going to discuss regarding the prevention of acute rheumatic fever. So prevention can be of two varieties, that is primary prevention and secondary prevention. In primary prevention, what we do is that we try to prevent the development of the disease itself. Now what we can do for the prevention of acute rheumatic fever is that we can eliminate the major risk factors, for example overcrowding in houses, to prevent the development of streptococcal A sore throat. And if somebody is not developing streptococcal sore throat infection, then there is no chance of development of acute rheumatic fever. But it is very difficult to eliminate the risk factors like overcrowding at different places. Second option is that development of a vaccination against streptococcus A, which is under trial, of course. And lastly, what we can really do is that we can give medications in patients with streptococcal A infection, sore throat. So what medications we can give? And very importantly, we need to start medicine with within 9 days of symptom onset. We can treat this group of patients with penicillin. We can give single dose of benzathine penicillin G 1.2 million units intramuscularly. Or if we are giving oral penicillin, we can give phenoxymethyl penicillin at a dose of 500 mg twice daily, and in case of children we can give 250 mg twice daily for 10 days. And otherwise we can also use amoxicillin, that is maximum of 1 gram per day we can use for 10 days. So this is regarding the primary prevention of acute rheumatic fever. Now coming to the secondary prevention of acute rheumatic fever, that means what we can do is that we can use drugs which will prevent the future attacks of acute rheumatic fever. Now the duration of secondary prevention will depend on many factors. It will depend on the severity of the acute rheumatic fever, it will depend on the age of the patient, and also it will depend on the duration since the last attack of acute rheumatic fever. Now, for example, if a patient has acute rheumatic fever without any carditis, this group of patients requires secondary prevention for the duration of 5 years after the last attack, or 21 years of patient's age, whichever is longer. Second scenario, the patient has acute rheumatic fever with carditis but no residual cardiac problem. Okay, this group of patients will require secondary prevention for a duration of 10 years after the last attack, or 21 years of patient's age, whichever is longer. Now, third scenario, where the patient has acute rheumatic fever with carditis with residual valvular disease. In these cases, patient will require secondary prevention, secondary prophylaxis for 10 years since the last attack, or 40 years of patient's age, whichever is longer, and sometimes they will require prophylaxis even for their whole lifetime. So this is about the duration of prophylaxis which you will prescribe for a patient for acute rheumatic fever secondary prevention. Now, what are the medications we can prescribe for secondary prevention? First, we can prescribe benzathine penicillin G. How to prescribe it? Patient needs to take benzathine penicillin G injection intramuscularly at a dose of 1.2 million units every 4th week. Means once in a month they can take, and sometimes the frequency can be once in 3 weeks, right? Next medication. Okay, if patient is taking oral penicillin, patient can take oral penicillin V, but again it is less effective than the intramuscular dose of benzathine penicillin G. If the patient is taking oral penicillin V, patient can take at a dose of 250 mg twice daily. And if the patient is allergic to penicillin, patient can take erythromycin 250 mg twice daily for the duration as I have mentioned. So this is about the secondary prevention or secondary prophylaxis of acute rheumatic fever. So whenever we are treating a case of rheumatic heart disease or acute rheumatic fever, we need to concentrate not only on the treatment of the acute episode, but we need to make sure that we prescribe medicine for secondary prophylaxis as well. Thank you so much. I hope this class was helpful for you.